Silent signals. 8 cancer warning signs every senior must know. Dear friends, imagine you're sitting in your favorite armchair, maybe with a warm cup of tea, when you notice a nagging ache in your leg that's lingered for weeks. Or perhaps you've spotted a strange mark on your nail that wasn't there last month. You might think, oh, it's just part of getting older, or it'll go away on its own. But what if these small signs are your body's way of whispering something far more serious? Something that could change your life or save it. As a doctor with over 25 years studying how cancer affects our bodies, I've seen how these quiet signals can make all the difference. The American Cancer Society tells us that 1 in 3 people will face cancer in their lifetime. But here's the hopeful part. Catch it early and treatment success rates can soar above 90%. Ignore those whispers, and survival odds can drop to below 20%. Today, we're embarking on a journey together to uncover 8 silent cancer warning signs, subtle clues that seniors often mistake for aging. These aren't the loud symptoms you see in headlines. They're the sneaky ones, backed by solid medical science, that could save your life or someone you love. Through heartfelt stories, clear explanations, and practical steps, I'll empower you to listen to your body and act before it's too late. Before we dive in, I want to invite you to join our community here on Health is Wealth, where we share life-saving health tips tailored for seniors like you. If you find this video helpful, please hit that red subscribe button and ring the bell so you never miss a video that could protect your health or your loved ones. Now, let's get started because this could be the most important hour you spend on your health this year. You might be wondering why these subtle signs deserve your attention. As we age, it's tempting to brush off new aches or quirks as just part of the journey. But cancer is clever. It hides behind symptoms we might call normal. The World Health Organization says millions of cancer cases go undetected each year because people overlook these clues. For seniors, catching these signs early is like finding a small leak in your home before it floods the whole house. I've sat with countless patients who wish they'd acted sooner, and I've seen the joy of those who caught cancer early and won their battle. Today, we'll shine a light on 8 warning signs, weaving together real stories from people like you in science to guide us. We'll explore each sign by understanding what's happening, what you can do, how others have faced it, and steps to take charge of your health. Let's begin with a symptom many seniors dismiss as just getting old, a deep, nagging pain in your bones. 1. Persistent bone pain, the ache that won't quit. As we age, aches and pains can feel like old friends who visit too often. But when you feel a deep, nagging pain in your bones, especially one that's worse at night, it's not just arthritis or an old injury. This could be a sign of osteosarcoma, a type of bone cancer, or cancer that spread to bone from places like the breast or prostate. It's a relentless, gnawing ache that doesn't ease with rest or over-the-counter painkillers like ibuprofen. You might also notice swelling or, in rare cases, a bone that breaks too easily. So, what can you do if you're feeling this kind of pain? Don't assume it's just aging. If the pain lasts more than 2 weeks, especially if it wakes you up at night or comes with swelling, see your doctor. Ask for imaging like an X-ray or MRI to peek inside your bones and find the cause. Let me share Margaret's story, a 68-year-old retired teacher who loved tending her garden. Margaret felt a deep ache in her shin that she blamed on kneeling in her flower beds. For months, she popped ibuprofen, thinking, this is just what happens at my age. But the pain grew worse, especially at night, and she noticed a small lump. Worried, she visited her doctor, who ordered an X-ray. The scan revealed early-stage osteosarcoma. Because Margaret acted when she did, surgery and chemotherapy stopped the cancer, and today she's back to planting roses, grateful she didn't wait longer. Science supports her story. The National Cancer Institute says catching osteosarcoma early boosts 5-year survival rates to 70%. If it spreads, that number drops to 20%. Margaret's experience shows how listening to your body can change everything. Here's how you can take action. Jot down when the pain started, how it feels, and if it's worse at night. A simple notebook can help you spot patterns. Gently feel for lumps or tenderness near the pain. Ask your doctor for an X-ray or MRI if the pain lasts more than 2 weeks. Early action can prevent serious issues like fractures. Keep your bones strong with gentle walks or chair exercises, but stop if pain worsens. Margaret's story reminds us that a persistent ache isn't something to ignore. Now, let's turn our attention to another part of your body that's always speaking your eyes. As seniors, we might notice our vision isn't as sharp as it used to be, but some changes are more than just needing new glasses. They could be early warnings of something serious. Let's explore the next silent sign and meet someone whose story will inspire you to take your eye health seriously. 2. Eye pain or vision changes. Your eyes are talking. Our eyes do more than help us enjoy a sunset or read a good book. They can reveal serious health clues. If you're feeling persistent eye pain, blurry vision that new glasses don't fix, or you notice a dark spot on your iris, the color part of your eye, it could be a sign of ocular melanoma, a rare but serious eye cancer. Seniors with light-colored eyes or fair skin are at higher risk. You might see flashes of light, or a spot that grows or changes shape. What should you do if you notice these changes? Don't brush them off as cataracts or eye strain. Visit an eye doctor or ophthalmologist for a thorough exam, including a digital retinal scan. Catching this early can save your vision and your life. Meet Robert, a 72-year-old grandfather who loved reading bedtime stories to his grandkids. One day, while checking his reflection, he noticed a dark spot on his blue iris. He thought it was just a quirk and ignored it. But during his annual eye exam, his doctor saw something unusual. A retinal scan confirmed early ocular melanoma. Robert had targeted radiation therapy and kept his vision. Today, he's back to reading stories and urges every senior to get yearly eye exams. The American Academy of Ophthalmology says early ocular melanoma has an 80% survival rate, but advanced cases can lead to vision loss or worse. Robert's quick action made all the difference. Here's what you can do. Note any blurry vision, spots, or flashes that don't go away. Schedule an eye exam yearly, especially if you have light eyes or a family history of eye issues. Ask for a retinal scan if symptoms persist. Wear UV-blocking sunglasses to lower your risk. Don't wait months for symptoms to resolve. Robert's story shows how our eyes can be powerful messengers, doesn't it? Now, let's look at another part of your body that's always talking: your skin. A simple rash might seem like nothing, but for seniors, certain skin changes can be a red flag for something serious. Let's dive into the next warning sign and hear a story that'll make you rethink those innocent spots. 3. Unusual skin rashes. When your skin sounds the alarm. We've all had a rash from dry skin or an allergy, but tiny red, purple, or brown spots called petechiae are different. These spots don't fade when you press them, and often show up on your ankles, legs, or under tight clothing. They could signal leukemia, a blood cancer more common in seniors. You might also feel tired or bruise easily. If you see these spots, what's the next step? Don't wait for them to disappear. If they last more than a week, see a doctor for a blood test called a complete blood count, or CBC. This test can spot low platelet counts, a key clue for leukemia. Let's talk about Dorothy, a 70-year-old who loved knitting blankets for her grandkids. She noticed small red dots on her legs after wearing compression socks. Thinking it was irritation, she ignored them, but the dots spread, and she felt unusually tired. Her daughter insisted she see a doctor. A CBC revealed acute leukemia. Dorothy started treatment early and is now in remission, knitting again with a smile. The Leukemia and Lymphoma Society says early leukemia detection can push survival rates to 60 to 80%. Dorothy's story shows how a simple blood test can change your future. Here's how to take charge. Look for spots that don't fade when pressed. Note if you're feeling tired or bruising easily. Ask your doctor for CBC if the rash lasts more than a week. Drink plenty of water to support healthy blood vessels. See a hematologist if symptoms persist. Dorothy's tiny spots were a wake-up call, weren't they? Now, let's turn to another often overlooked part of your body: your nails. A small change in your fingernails or toenails could be more than a bruise or a quirk. Let's explore the next warning sign and meet someone who learned this the hard way. 4. Strange stripe on your nail, a hidden danger. A dark vertical stripe on your fingernail or toenail called melanonychia striata. Might look like a bruise, but could be subungual melanoma, a rare skin cancer more common in seniors. It often appears on the thumb or big toe and may have uneven colors, blurry edges, or pigment spreading to skin around the nail, known as Hutchinson's sign. What should you do if you spot this? Don't assume it's a bruise or fungus. See a dermatologist for a biopsy if the stripe grows or changes. Early detection can prevent serious outcomes like amputation. Consider James, a 75-year-old retired mechanic who loved tinkering in his garage. While clipping his nails, he noticed a dark line on his thumbnail. He thought it was from an old injury and ignored it, but the line widened and his nail started splitting. A biopsy confirmed subungual melanoma. Surgery caught it early, and James kept his thumb. He now checks his nails monthly and urges others to do the same. The American Academy of Dermatology says early subungual melanoma has a 90% survival rate, but delays drop that to 30%. James's story is a reminder to stay vigilant. Here's what you can do. Look for dark, widening, or irregular stripes on your nails. Request a biopsy from a dermatologist for suspicious changes. Wear gloves during chores to avoid nail trauma. Don't wait months for a stripe to heal. Check all your fingers and toes regularly. James's story shows how a tiny nail change can carry a big message. Now, let's talk about something many of us experience as we age, waking up at night feeling too warm. But when those night sweats become more than just a hot room, they could be a warning sign. Let's dive into the next sign and hear a story that'll make you rethink those sweaty nights. 5. Night sweats, when your body overheats. Waking up drenched in sweat, even in a cool room, isn't just a warm blanket or menopause. Persistent night sweats could signal lymphoma, a cancer of the lymphatic system that's more common in seniors. These sweats are intense, often soaking your sheets, and may come with fever, weight loss, or fatigue, known as B symptoms. What's the next step if you're waking up soaked? Track how often it happens. If it's regular for 2 weeks, see a doctor for imaging or a lymph node biopsy to rule out lymphoma. Let me share Eleanor's story, a 69-year-old who loved ballroom dancing with her husband. She started waking up drenched every night, blaming her thermostat, but she also lost 10 pounds without trying and felt tired. A biopsy revealed Hodgkin lymphoma. Early treatment helped Eleanor get back to dancing, twirling across the floor with a smile. The National Cancer Institute says early lymphoma detection can yield 85% survival rates. Eleanor's quick action saved her passion and her life. Here's how to act. Note how often and how severe your night sweats are. Watch for fever, weight loss, or fatigue. Request imaging or a biopsy if sweats persist. Use breathable bedding to rule out environmental causes. Don't dismiss persistent sweats. See a doctor. Eleanor's story reminds us that our bodies send signals even in the quiet of the night. Now, let's move to a symptom many of us know all too well: heartburn. For seniors, persistent heartburn isn't just about last night's spicy dinner. It could be a sign of something far more serious. Let's explore the next warning sign and meet someone who learned this just in time. 6. Persistent acid reflux, a burning warning. Heartburn that won't go away, even with antacids or diet changes, is more than indigestion. Chronic gastroesophageal reflux disease, or GERD, could signal esophageal cancer, especially in seniors. You might also notice difficulty swallowing, food getting stuck, or unexplained weight loss. What can you do if heartburn lingers? If it lasts more than 3 weeks, see a gastroenterologist for an endoscopy to check your esophagus. This can catch precancerous changes like Barrett's esophagus early. William, a 73-year-old retired banker, had heartburn for years. He treated it with antacids, thinking it was spicy food or stress. But when he started choking on meals and lost 15 pounds, he saw a specialist. An endoscopy found early esophageal cancer. Treatment was tough, but William's early action saved his life. The American Cancer Society says early esophageal cancer has a 50% survival rate, but late stage drops to 10%. William's story shows why persistence pays off. Here's what you can do. Note if heartburn resists treatment or worsens. Watch for difficulty swallowing or food sticking. Ask for an endoscopy if symptoms last 3 weeks. Avoid trigger foods like spicy or acidic items. Don't normalize chronic heartburn, see a specialist. William's story is a powerful reminder not to ignore what feels like a minor annoyance. Now, let's turn to a sign that's easy to spot but often misunderstood: changes in your skin's color. A yellowish tint could be more than a passing issue, especially for seniors. Let's dive into the next warning sign and hear a story that'll make you take notice. 7. Yellowing skin, a signal from your organs. If your skin or the whites of your eyes turn yellow, it's called jaundice, and it could point to pancreatic or liver cancer. Tumors can block the bile duct, causing bilirubin to build up, giving your skin a yellowish tint. You might also notice abdominal pain, dark urine, or pale stools. What should you do if you see this? Jaundice in seniors is never normal. See a doctor immediately for an ultrasound or CT scan to check your pancreas or liver. Helen, a 71-year-old avid baker, noticed her skin looking yellow during a family gathering. She also had vague stomach pain and dark urine. Thinking it was a digestive issue, she waited weeks. An ultrasound revealed pancreatic cancer. Early treatment helped Helen keep baking her famous pies. The Pancreatic Cancer Action Network says early pancreatic cancer has a 30% survival rate, but late stage is below 5%. Helen's story is a wake-up call. Here's how to act. Look at your skin and eyes in natural light for yellowing. Note abdominal pain or changes in urine or stool. Request an ultrasound or CT scan immediately. Eat liver-friendly foods like greens and lean proteins. Don't wait. Jaundice needs urgent attention. Helen's yellow skin was a signal she couldn't ignore, and it saved her life. Now, let's talk about something many of us have felt: a fever. But when a fever lingers or keeps coming back, it's not just a cold. For seniors, it could be a serious warning. Let's explore the final warning sign and meet someone whose story will inspire you to act. 8. Persistent fever. Your body's cry for help. A low-grade fever that lasts weeks or comes and goes without a clear cause could signal leukemia or lymphoma. These cancers trigger inflammatory molecules that keep your temperature elevated, often over 100.4 degrees Fahrenheit. You might also notice night sweats or weight loss. What's the next step if you're running a fever? If it persists for 2 weeks, see a doctor for a complete blood count, or CBC, or imaging to check for blood cancers. George, a 74-year-old veteran, had a fever for weeks along with night sweats. He thought it was a lingering cold. Blood tests revealed chronic lymphocytic leukemia. Early treatment helped George manage his condition and enjoy his fishing trips. The Leukemia and Lymphoma Society says early detection can boost survival to 60 to 80%. George's story shows the power of acting on persistent symptoms. Here's what you can do. Use a thermometer to monitor your temperature daily. Note cyclical fevers or night sweats. Ask for a CBC or imaging if fevers last 2 weeks. Rest and stay hydrated to support your immune system. See a hematologist for a thorough evaluation. Dear friends, the stories of Margaret, Robert, Dorothy, James, Eleanor, William, Helen, and George are more than just stories or lessons from real people who face cancer, and won because they listened to their bodies. As seniors, we have so much to live for: family, hobbies, new adventures. These 8 warning signs: bone pain, vision changes, rashes, nail stripes, night sweats, heartburn, jaundice, and fevers are your body's way of saying, pay attention. Here's what we've learned. 1. Listen closely. Persistent symptoms aren't just old age. Track patterns. 2. Act quickly. Early action, like Margaret's x-ray or George's blood test, can save your life. 3. Be your own advocate. If your doctor dismisses you, ask for tests. You know your body best. 4. Stay proactive. Regular checkups like eye exams or blood tests catch cancer early. 5. Share the knowledge. Tell your friends and family about these signs. You could save a life. Cancer doesn't have to steal your joy or your future. You have the power to catch it early and fight back. Here's your action plan to thrive in your golden years. Spend 5 minutes today checking your body for these 8 signs. If you're overdue for a checkup, call your doctor this week. Share this video with a friend or family member. It could save their life. If this video touched your heart or opened your eyes, please hit the like button Subscribe to Health is Wealth and ring the bell for more health tips designed for seniors like you. Drop a comment below, share your story, or ask about a symptom. I'm here to help. Let's keep thriving together and make every day in our golden years count. Thank you for watching, and here's to your health and happiness.